Okay. Hi, I'm Ed Ullmann from Wellness RX Pharmacy. Today we are going to talk about some of the tensions in healthcare which make it really difficult to make real long-term change for the public good. Today we will look at the different sectors that are involved in healthcare, try to better understand how their agendas don't always match up with society's agenda of fairness and equity and the improvement of the healthcare status of its citizens. First, I want to take a look at the payers of healthcare services. After World War II, our country made a decision to adopt a system where employers would provide health insurance coverage for their eligible employees. Early on, the insurance system that was then dominated by state-regulated Blue Cross Blue Shield organizations, and each employer, and sometimes in partnership with a union representative, would then turn around and decide on what the benefit package would be for their employees, and then they would decide on what kind of cost-sharing provisions would occur in the form of deductibles and co-pays or payroll deductions to do the cost sharing for the premiums. Well, through the years, this system had reasonable success as employers tried to secure competitive monthly premiums from insurance companies and tried to push costs onto employees whenever they could. On the other hand, the employees had a different agenda. They're consumers of care and they want to maximize their benefits and they want to have little out-of-pocket costs as possible. So that's our number one private payer of healthcare. But in 1965, Medicare, which is our national healthcare program for seniors, and Medicaid, which is a state-federal partnership program, those two came in, and now we're looking at this 56 years later. And those two programs, Medicare and Medicaid, account for providing coverage to about 26% of Americans. However, when you drill down and look at the total cost for that population, we then look and say Medicare, where seniors have sometimes 10 to 12 times of many healthcare services as the under 65 population. And then Medicaid, if you take those two together, you add it to the cost of our VA healthcare system for our veterans. And then if you add that to the cost of providing benefits to federal employees and their retirees, which includes oftentimes the military, when we add those all up, the public sector is now spending 57% for healthcare spending in America. So we've got to put it into a context that yes, we have the employers that are providing health insurance for their employees, and we do have individual small businesses that buy their own health insurance, and we now know we have about 14% of people now that are medically uninsured. But overall, we in effect have a public financed healthcare delivery system and in this country. And so it's really kind of fascinating. We then look at the tension that occurs from the insurers of care. So the employers purchase it, the government purchases it from the insurers. Well, who are they? Well, I'm going to tell you that now 70% of eligible Americans belong to a health maintenance organization, or HMO, or as we now call them as managed care organizations. That's a lot of people. And what they try to do is they are mandated at the state level to combine the delivery of healthcare with the financing of healthcare. So for many individuals, these are good benefits, especially the Medicare Advantage plans for seniors for it. So we'll turn around and we look at that and go, all right, who are these organizations? I was kind of amazed that 60% of the managed care organizations or other health insurances, 60, are nonprofit organizations. and 40% are for-profit, but many of them are publicly traded enterprises. So it's kind of an odd sense on the insurers. It can be extreme for both on the public side, or it could be pure American capitalism at its best. So we turn around and go, all right, if we have our insurers, whether it's nonprofit or for-profit, we still have to understand they got stakeholders, they got shareholders, they got board of directors, that they have to meet obligations, and they have to demonstrate that they are sustainable and that they can operate in a profitable manner. I don't know, sometimes do they always have society's agenda at heart? And then we turn around and look at the providers of care. Now this is really interesting because we start first to look at our nation's hospitals, because they account for 33% of all healthcare spending. Well, I found it very, very surprising, but actually positive, that 82% of the nation's hospitals are nonprofit organizations. And for the most part, I believe our hospital systems understand their responsibility for the public good. Then we look at the next highest sector on the provider side for healthcare, and we then look at physicians and professional and clinical services. That makes up about 20% of healthcare spending. So 33% of the hospitals, 20% for the doctors in related clinical services. I also was amazed to find that 70% of American physicians today are now employed. They're employed by hospitals or their healthcare systems, or they're part of for-profit medical groups, which can grow to be 200, 400 doctors in size, or they're owned by private equity firms. It's a little secret that no one quite realizes. So what we look at is that overall, our doctors in most of the clinical services related to that are for-profit ventures. And then we look at pharmacy, and pharmacy now accounts for 10% of all healthcare spending, and almost 100% of retail pharmacies in America are for-profit enterprises. And then the remainder of spending will be diagnostic services, long-term care, the majority of for-profit enterprises, laboratory services, and miscellaneous small practices. But you can understand the conflict that can occur for the providers who deliver the care, that it's kind of all over the place, and we wonder about, are they creating their own demand? Are they really at the center of society's agenda to help out better our citizens, or are they somewhere in between? So finally, I wanted to look at the one that's most intriguing to me, and that kind of operates under the radar. And this is what I call the investors in healthcare. These are across the board, all for profit. We start with our pharmaceutical companies. And we talked about them last time that, they, yes, produce great drugs, but should we be paying more than twice as much for prescription medications in this country than any other country, including Canada? I don't think so. Who else are these investors companies? Well, they're the medical device companies. Yeah, look and go closer to see. Oftentimes, there's not a high regulatory process for these companies, and their practices of marketing and trying to get the attention of our health professionals to use their products is borderline on suspicious. But they feed off the industry. What about our banking industry? Well, they all do very quite well with the transactions of healthcare dollars. And then what about Wall Street investors? Well, look closely, because the private equity firms are very deep into the ownership of healthcare in this country. And then we have Wall Street and stocks that are all part of our healthcare companies and hospitals and so on. So Wall Street is very much involved. And then if you go down further, there are so many small and medium and large sized businesses and vendors and consulting firms that they all depend on the healthcare dollar for their livelihood. So, woo, we got all of these kind of mixed bag of conflicts. And so when we do look at this tension between healthcare payers, right, they pay the bills, health insurers, they take the responsibility for the risk to provide the healthcare benefits for individuals, the providers of care who deliver, and we spoke about that several modules ago about the shortage of especially in primary care medicine in this country, and then we look at the investors that are very active in this American healthcare system, which is 18% of our wealth. So there's a lot of hands digging in to this pot. And we then turn around and go, all right, it's American capitalism. People have their own agendas. They have responsibilities. They're morally trying to do what they believe is right. And I think most do. But really, do they have society's agenda at the center of their decision making? And that means fairness. All right, that means equity, to try to treat all individuals with the same benefits. We found coming out of COVID that there was a big disparity in racial and just the way that, it wasn't until about 10 years ago that we balanced the health insurance called actuarially between men and women to be more fair. And so there's a lot of different things that we have to look at, but I don't think that we will see that this is going to change at any time soon, especially again when we have almost 11% of all American jobs which are related to healthcare. Listen, I want to just say to you that today we're going to end our last module on trying to kind of lay out some of the challenges that we have going forward in healthcare. I hope that we provided a little insight into some of the challenges that we face. I have tried to be as honest and open and down middle of the road as I can. I'm just trying to report the facts as I see them. And I want to try to provide hope. And so on our last two modules, I wanted to look and try to present where are we going, how can we make a difference, and kind of try to frame the decisions that our policymakers have to make, and the decisions we as a country have to make with our own families and the way we conduct ourselves in our society. And what we gotta hope that we can do is together make intelligent decisions so we create a more sustainable healthcare future for tomorrow's kids.